Welcome students. Today I am going to take class on anatomy of prostate gland. Prostate gland is an accessory male reproductive gland. As you can see, this inverted cone-like structure, this is the prostate gland. So first of all, where is it situated? It is situated in lesser pelvis, see, below the bladder, and it is present between the lower part of pubic symphysis. This is pubic symphysis and this is the ampulla of rectum. So it is between the lower part of symphysis pubis and ampulla of rectum, and it is around the neck of bladder, and from its shape you can see it is inverted cone-like in shape. So now we will talk about the dimensions. Dimensions 2, 3 and 4. Just remember these things: 2, 3, 4. So it is 2 centimeter thick. We are seeing from the side, right? 2 centimeter thick, 3 centimeter long, but it is broad. How much? It is broad by 4 centimeter. So it's 2 centimeter antero-posteriorly thick, 3 centimeters vertically long, and 4 centimeter transversely broad. Clear? And its weight just double the 4, 8 grams. So 8 gram is its weight. Clear? So these were the dimensions. And now, since I have said that it is conical in shape, so what are the various borders and surfaces? First of all, it is having one apex and one base. Clear? Then it has got anterior surface. See, this is anterior, so this is anterior surface, this is posterior surface, and 2 inferolateral surfaces. So it has got an apex, base, anterior surface, posterior surface, and 2 inferolateral surfaces. So now you know about the position of this gland, you know about dimension of this gland, you know about the borders and surfaces of this gland. Now it is an accessory gland, as I said. Now we have to see why this gland is present. It produces prostatic fluid. Prostatic fluid, see, you can see one duct here. So it is adding this prostatic fluid to the seminal fluid so as to increase the bulk of spermatic fluid. The spermatic fluid that was carried by vas deferens, it is increased and of course reinforced by the alkaline, fructose and vasculase containing seminal fluid, and now it is added by the prostatic fluid. Also bulbourethral gland is there, which is also known as Cooper's gland. It is also adding its fluid to this seminal fluid. So 3 glands are adding their secretions to the secretion of testis: seminal fluid, prostatic fluid, and the fluid from bulbourethral gland or Cooper's gland. Okay. Now, many people have described it in many ways. Some have described it in form of lobes. If we just look at it, that how many lobes this gland has, we can see this as a landmark. Okay, urethra as a landmark. So this is the anterior lobe, and this whole thing you can take it as a posterior lobe, but this portion above the ejaculatory duct, this portion is called median lobe. So anterior lobe, posterior lobe, median lobe. And because we had 2 inferolateral surfaces, we have got 2 lateral lobes also. So if we divide it into lobes, we find these lobes. Then if we cut it and see it from inside and divide it into zones. Previously, MacLean had divided it into 3 zones. The peripheral zone was forming around 75% of its portion. That was the outer zone. And outer zone, it comprised of 75% of this gland, and it was also prone to prostatic cancer. That means if a prostatic cancer is occurring, it is bound to occur in the outer zone. Then the second zone was the middle zone, which contained around 25% of this gland. So 75% formed the outer zone, 25% formed, 70% formed the outer zone, 25% formed the middle zone, and 5% formed the periurethral zone. Now the periurethral zone was prone for benign prostatic hypertrophy, BPH in other terms that you know. So this was the division in zones by MacNeil. But when we cut it and studied it histologically we found that there are only 2 zones in which it is divided. Otherwise all the cells are same. Cells are same, but according to the ductal system, it is divided into 2 zones, outer and inner zone. The outer zone was more prone for cancer and inner zone was more prone for benign hypertrophy. There are 2, actually growths are always divided into 2, benign and malignant. So malignancy, malignant growth, benign growth which is not dangerous to life, and malignancy is the actually carcinomatous. So malignant growth were seen in the outer zone, benign growth was seen in the inner zone. So this is what we found in histopathology. Now, since it is lying in the lower pelvis, it is lying between the lower portion of the pubic symphysis and the ampulla of rectum and below the neck of bladder. So the arterial supply is by inferior vesical artery, middle rectal artery, and also internal pudendal artery, which is an artery of pelvic region. So these are the 3 arteries which supply prostate gland. And the venous drainage is also similarly going to I will just say the venous drainage is going to internal iliac artery. Now the lymphatic drainage. Since this organ is present between the pelvic, the lesser pelvis, so between the pubic symphysis and rectum and below the bladder. So it is drained by the sacral lymph nodes and internal iliac lymph nodes. Very few lymphatics they drain in the external iliac lymph nodes. And since it is related to the sacral lymph nodes, so the malignancy is usually spread to the vertebral column. So this was the anatomy that you should have known about prostate gland. Now the applied anatomy. In applied anatomy, 2 things are important. 2 conditions that are important, which you will be learning in surgery class. One is benign prostatic hypertrophy. As I have said, it occurs in the inner zone or the median lobe. That hypertrophies and obstructs the urethral opening in the bladder, and so it results into the obstruction of flow of urine, and that has to be removed. Then the outer zone is more prone for carcinomatous growth. So if the growth is in the outer region, it is carcinomatous, and it is drained by the lymphatics which are going to the vertebral column. So the vertebrae are affected very soon. So we have to be careful about it. And the third thing that we have to know about it in applied anatomy is that to differentiate when we do PR or per rectal examination, if it is seen to be fixed to the fascia, then it is carcinomatous. It is going to be carcinomatous most probably. But if it is freely mobile and enlarged, the growth is likely to be benign in region. And now we come to the capsules also. There are capsule of this gland also. True capsule and false capsule. True capsule, which is encircling the gland itself and it is embedded in the gland, it is fibromuscular in nature. And the false capsule is formed by the fascia of the pelvic region. So I think you have understood about the anatomy of prostate gland. Thank you.